Hello and welcome to The View from 4 feet and 3 inches. I'm your host, Cassidy Huff. Welcome back to part 2 of last week's episode with my surgeon, Dr. Klane White. I'm going to do a visual description of both of us so that you can jump right into the nitty-gritty of halo traction, spinal fusion, and what life looks like for me now. Am I allowed to do anything? What I'm not allowed to do, and he answers some of your questions that you submitted on Instagram. I do want to give a trigger warning because we do talk about surgery and medical trauma, as well as some pretty gruesome details of my surgeries that I went through regarding halo traction and spinal fusion. So if that's not something that you are able to stomach, or you get a little bit queasy talking about things like bone grafts or blood or anything like that, you might want to sit this one out. So I am a white woman. In this episode, I am wearing a white sweater. I am wearing baby blue podcasting headphones, my black rimmed glasses, a full face of makeup. My blonde hair is down, and I am sitting in a faux leather chair. And my guest, Dr. Klane White, is a white man who is balding, who is wearing a bluish gray button-up shirt and has a white wall behind him. Let's dive into the episode. Moving back to the medical stuff, because I didn't just have surgery every 6 months for vector rods. Eventually, those vector rods were taken out.
Yes.
So can you talk and explain a little bit about what halo traction is and why I needed it and why, like, what it does?
Yes. I just put a kid into a halo this week. So we still use halo traction a lot. So what halo traction is we, as it sounds like, you're put into a halo. So if you ever look at some, historically when people had neck injuries, we'd put them into a halo and a vest. Now we don't do that as often anymore because we have good implants to do that. But you can do the halo and then hang it from some weights. And the idea is we call it halo gravity traction.
Sounds horrible. It sounds like a medieval torture device.
Yeah, it does look like a torture device.
It does.
And some, we kind of call it a crown of thorns sometimes because you put a lot of pins in to hold into the skull.
Yeah, I had 8 pins. You can still see my scars.
Yeah.
8 pins screwed into my head.
Yeah, I my kid this week I put 10 in. But the idea is that then by pulling through your head, it stretches out your spine. And there's a lot of benefits to this. A, it helps straighten your spine. B, if you're going back to do a more definitive surgery to get correction, it puts a little stretch on the spinal cord. And as I mentioned before, with kyphosis, your spinal cord gets shortened and pulled over a corner. And so if you try and straighten it real quickly, then that stretches the spinal cord and you can end up paralyzed.
Fun.
Yeah. So it's a high risk, high stakes surgeries we're doing. And so the traction gives you a little stretch on that. It gets your spinal cord kind of prepped for that. The other thing is it actually helps you breathe better because it opens up.
Yeah, I did notice that.
And the other part is that, because when you have these deformities, you have to work harder to breathe. It's really hard to gain weight. And that's why, you were always so thin.
Still am.
Yeah. So, but, and for us, we want to put implants in. We want you to gain a little weight. And so what we do is we put you in traction. And then because you can breathe more easily, most of the kids put on about 5 or 10 pounds while they're in traction. So for multiple reasons, it makes the surgery safer. When we're going to do what we call a definitive fusion, when we're going to try and do that final, correction of your spine, when you're close enough to being done growing, that it won't affect the overall, length of your thorax, your chest. So. And that's when you get a lot of the strawberry, or the raspberry, vanilla, mocha, white mocha.
I was going to ask you about that. So,
yeah. So,
you broke rules, and you I can't. I think I remember how it happened. So when you put the halo on, you don't just put the weights on automatically,
No,
right?
no, gradually go
Because that
up.
hurts.
Yeah.
So I had the halo put on, which was a whole thing in and of itself because your head is automatically really heavy, and mine was like I ideally your head and neck are being held up, right? So um I was attached to the bed with no weights on, but I couldn't like sit up unassisted because I have no hardware in my back. So you've taken all that out, right?
Mhm.
I have a halo in my head, 8 pins are screwed in my head. You have to clean those twice a day. That's a whole thing. So that they don't get infected. All right. I'm recovering from spine surgery because you just took all my stuff out. Ideally, you are in the hospital for 6 weeks. I was in there for 8, um, which we'll talk about. And so you were adding the first weights on, I think is how this worked. You were adding the first weights on, and it didn't feel good.
Mm.
Didn't feel good. Does not. It hurt.
Yeah.
And
Yeah.
I was hysterical. I was crying. It was not a fun time. I was 13 and it was not an exciting time. And you eventually were like, okay, let's take a break. We're done for right this second. Like we do have to do this today, but we will take it slow. Let's take a 15-minute break, just to give you some time to calm down. And then you go, I'm going to Starbucks. What do you want? And I was like, what? And you were like, what do you want from Starbucks? And I was like, it was just such like a random question. And it kind of snapped me out of my crying fit that I was having. And I was like, I don't know. And so I don't even remember what it was. It was like
Raspberry
a
mocha frappuccino with half and half instead, because
oh,
I
okay.
that's
You
my.
still know it.
Oh yeah, I remember.
Uh,
I ordered it multiple
and
times. Let's just say.
not even multiple times. It became you came in at 6 a.m. every morning for rounds. I am not a morning person. That is number one. Anybody who saw me during that stay knows I'm not a morning person. And I didn't have to be awake for these rounds, but I felt like it was a necessity. I was 13. Like I could understand at that point what you guys were saying, and I wanted to know what was happening with my body, right? Because these were like the updates every morning.
Yeah.
I wanted to know, and so the next morning you showed up with the drink again, and then the next morning again, and then the next every day for 52 days you showed up every morning with the same thing, like 5 to 6 days a week usually.
Yeah, yeah.
So that was fun. So that's why I didn't know that was why, because one, you wanted to stop my anxiety attack, but two, you were trying to get me to gain weight. That was a really good way to do it, might I add.
Mhm. Yes. As
So one
hungry
of
as possible.
apparently, still that's the case. I'm over 80 pounds now. Whoa. Yay. At this point, I think I was like 60 pounds. Like I was real small. Um, so you did the halo, and then let's talk about the Dural Tear that
Hmm,
happened. So there
okay.
was. What do you mean? What was that face for?
Well, it's a complication. We don't tend to like to talk about our complications, but no, I'm happy to.
Well, I want to talk about it.
Yeah.
I mean, it was an important part of the surgery. So
Yeah.
first of all, you do have to. I had to stay in the hospital for the entire time that I had the halo on. Why do some people get to go home, and why wasn't I allowed to?
After traction or during
Mm-hmm.
traction?
During traction.
That's an institutional bias. Actually, now
Mm,
here we send the kids home in Colorado. Yeah,
I can't imagine.
so where I trained in Texas, it was the kids were kept in house. And that was what kind of most people were doing at that time because they weren't really comfortable sending people home.
I wouldn't be comfortable with
But I
it.
think now, well, so there's upside and downside to this though, because when they go home, I don't know how much they're actually in traction.
Yeah,
They're in
that's
the
true.
hospital. I know they're in traction.
And you know exactly how much weight they have,
Yeah,
and
the
like you
families
have
get pretty
tabs on
good
them
about
every
it.
day.
Yeah, yeah, and they're probably. I'll be honest, they're probably in traction less when we send them home
Mm.
than when we were in the hospital. You know,
Do you
we
mean
were.
like attaching the weight to them
Yeah, yeah. So,
less?
well, yeah. So I think they're in traction maybe 10 to 12 hours a day.
What do you
When you,
mean? I was in traction 24
yeah,
hours a
exactly,
day.
exactly my point. So, I've
How are
also.
you not in traction? Your head is just free floating? Like, what are you doing?
Well, they say we just unhook it, and it's usually you're lying in bed, or sometimes they'll sit up, and which is a little counterproductive. So that's
That's
why,
crazy.
yeah. So I'd rather, there are definitely upsides to keeping the kids in the hospital, and that was just kind of the what we did at that time, and it's probably better, but
Mm. I agree. I couldn't imagine unhooking myself from traction because after I got over the initial anxiety of having weights attached to my head, quite literally, I loved it. I looked forward to the weights being added because it was I felt the stretch
mhm,
and it felt good, and also I could breathe for the
yeah,
first time in my life. So I was able to sing better. And
mm,
that's what I did every day. Was I would sing in my room, I would sing in the playroom, I would sing downstairs. I would At one point we had one of those bags that you throw up in. Um, and I was busking in the hallway.
with
I would
with
busk.
a bus.
Busking means like, you know how people stand on the street and sing and you give them money?
Oh, okay.
I was doing that in the hospital hallway,
Oh, I got you. Okay, gotcha.
attached to the IV pole and everything. I
Entertaining.
was playing my ukulele. Anyways, so I had fun during those 52 days. I will say I had my 14th birthday in the hospital. That was the best birthday I've ever had. I'm not even saying that ironically. Completely unironically, that was the best birthday I've ever had. The news showed up for it. Um, we had it on the rooftop.
That's right. I remember that.
Um, Everybody came. They made me a cake. I don't know where they got the cake from. I had like the hospital put this birthday party on for me. They did whatever I wanted. I was like, this is the food I want. This is the cake I want. This is everything. Everything was done. The whole rooftop was
Yeah.
blocked off so that nobody else could come up there. And the news, it was a whole thing. Had a lot of fun. Had a lot of fun with all the different kinds of therapies, even physical therapy. I was kickboxing in there. I don't know why they had me do that, but that was fun. Um, and so you think of like, 52 days in the hospital, that sucks. Not for me. I was living it up in there. I was eating my strawberries every day. Had my strawberry raspberry frappuccino, whatever that was. Um, I was doing great, I might say.
You did
Um,
have the place pretty wired, I'll have to say.
I did. I did. And I got whatever I wanted, pretty much whenever I wanted. Everybody knew who I was. I was the kid in Halo, walking around in the walker, in the wheelchair, in traction, whatever. So there are a lot of risks. This was a huge surgery. Um, not only becoming paralyzed, but also I ended up with a dural tear. So could you explain a little bit about what that is and about the
Yeah.
CSF leak that I did have?
Well, so seeing as your spine had already been operated on well over 35 times at that point, I'm sure, there was a little
Yeah,
scar
this was
tissue.
surgery number 38.
Yeah, that's I
I
would guess
think.
it'd be around that time. So,
Yeah.
um, we had to open up your spinal canal, and to try and because what we were doing is we were actually removing. So we go around the spinal cord and take bone away. And you had what we call the pedicle subtraction osteotomy. So we unroot the spinal canal, and then we go the bone that it comes from front to back that connects the front to the back. are called pedicles. So we have to take all that out, go all the way to the front, and take a whole wedge out of your spine to get it to go straight. And so because there was scar tissue around there, you can get, it's obviously a pretty technical surgery. And so if you get a little nick in the dura, which is the lining to the spinal cord, then you have to repair it and and then because if it doesn't seal, then you get a collection of spinal cord fluid, you have headaches, and it's, you can
Not just headaches, the worst migraines you've ever had, ever.
Yeah, you can get, and you can even end up with meningitis if it gets infected. So it's, it's a
We
pretty
avoided that.
problem. Sorry?
We avoided the meningitis.
Yeah, I know we did. I think probably, you had to lie flat for a little while afterwards.
10 days.
Okay. So, yeah. Yeah, so usually it's only a day or two, but,
it was not.
depends on the situation and, how symptomatic you are. And so, I can't remember the details of yours case specifically, but it's something that happens with complex spine surgery on occasion. So
yeah, I had to lay flat for 10 days. Was still singing though. Nobody could stop that. I had to lay flat for 10 days, and then there was an issue because I had to move up to the ICU during that point because the nurses had to titrate the drain depending on what side I was laying on. It drained different levels.
Yeah, okay.
So I don't know why. It just does. So you have to drain that out. You have to drain the excess CSF, spinal fluid, out.
Yeah.
So I had one lumbar drain.
Yep.
And I had to obviously move because otherwise you get pressure sores. So I was moving every couple hours, and we found out that depending on what side I was laying on, it would drain a different amount. And so because of that, the nurses were like, we can't constantly titrate the drain up and down. We have to move you to the ICU. So I wasn't necessarily in the ICU because of my symptoms. I was in the ICU because of the drain itself, and because of how much attention I needed because of the drain. But yeah, I remember that the lights had to be off. No one could be in there. No one could speak. Otherwise, I would just burst into tears because my head hurt so bad. You at one point prescribed me caffeine pills because my migraines were so bad, and caffeine helps with migraines. And you were like, you were like, do you want to drink coffee or do you want caffeine pills? And at 13, I went, I want to drink coffee. And you were like, okay. So I was drinking 3 shots of espresso every few hours and still sleeping because CSF, drain, halo, spine, all of the above. My body was out. So that added a few extra weeks onto how long I was in the halo. Because usually it's only supposed to be 6 weeks, but for me it was 8. I know you want to see more of my content. That's why I started a Patreon just for you. If you subscribe to a monetary tier on my Patreon, you automatically get access to hours of unseen footage. Behind the scenes, post shows, weekly life updates, weekly private live streams, and of course, so many never before seen pictures and videos of Champ and Monty. So what are you waiting for? Head over to my Patreon and check out all of the perks that I have for you. And then let's talk a little bit about spinal fusion. So what did that entail for me? Obviously, it meant taking the halo out, which I was upset about, by the way. I wanted that halo to stay in because I could breathe. But let's talk about why a spinal fusion was necessary for me and why it looked a little bit different than it does for everybody else. Because that OR was packed. I remember coming into that OR. There were a lot of people in there.
It's quite the endeavor. So as I've already mentioned, you had a pretty complex spine deformity. So the idea is that you had growing rods for the first part of your life. And again, the idea there is to allow your chest to grow, but growing rods don't last forever. For the reasons we already mentioned out, they can pull out, they can break, and they're just not a long-term answer in people who are more mobile like you are. What we do is we call it definitive fusion, which means, okay, we don't think you're going to grow enough anymore to warrant this continued return to the operating room to lengthen your rods, deal with all the complications of the rods, and so forth. So in order for that fusion to work, we had to correct your deformity as much as we could safely. And for you, that was what we call a pedicle subtraction osteotomy. And I think we did some other osteotomies that were a little less aggressive around that as well, just to get your spine, reasonably straight. Because if you don't, then the fusion will fail because for the same reasons that it's too much stress on the implants. But what a fusion is what we call actually an instrumentation and fusion. So we put screws in, we put rods in. We use the rods and the screws to correct the deformity. And in you, we had to take some extra bone out to really correct the deformity. And then what you do is you put bone graft in around that. And for us, we use donated bone that your body then integrates to become your own bone. And so if we were to go back and look at your spine surgically, you would have a long sheet of bone. So we have individual vertebra that stack on top of each other. And that gives you motion in the spine there, right? But for you, those were all fused together through a sheet of bone in the back that used to be a bone graft, but now it's your bone.
It was somebody else's bone?
Yeah. As one of my mentors used to joke, it was probably some old smoker from Florida, But,
oh my God!
that bone is now yours. It's just a lattice.
Right.
Yeah.
Right.
It's just a lattice. So your bone creeps into that bone and then it absorbs it and lays down your own bone on top, around it and on it.
Is there a fear that my body won't do that and it would reject it?
No, because that bone graft because it's just the mineral. It's not the actual all the cells and stuff that go in it. So it's not. There's no reaction to it. So that's for you. And we may have even used. I don't remember. We might have used some adjunct medications to really help you fuse. With some special proteins and so forth. I would be surprised if we didn't. So something called bone morphogenetic protein helps. We probably use that on you as well, especially right at the apex of your kyphosis. So anyway, so that's the fusion part. So now that part of your spine doesn't move, but hopefully it's not so much that you're again. I know you. It doesn't. It changes your mobility to a certain extent, but not too much. But it's the only way to hold.
I still got my dance degree, so that tells you anything.
Yeah, exactly. There you go. Yeah, no, it does. Yeah, so it doesn't really keep people from doing most things, but it's the only way to hold your spine straight for the rest of your life.
Mm-hmm.
Yeah.
So, can you explain why I still have the curvature on my back that you can see? Because I think a lot of people, when you say straight, they're like, then why does she still have that?
Straighter, yeah.
Straighter. As straight as can be.
So I think, that's always, like every other surgery, is a risk-benefit discussion. There are more aggressive surgeries you can do, where you actually, literally where you totally disconnect the spine. I think we just felt that we didn't have to be that aggressive to get the result we needed. So, having a little bit of deformity left as opposed to being completely straight, without with less risk to regard to, your spinal cord, and also it's actually more likely to heal. So, yeah,
makes sense. So that was supposed to be my last surgery, but it wasn't because I'm dramatic. And so I ended up having some infections after that because my rods eroded. Actually, I think it was the screws. The screws eroded. And so I literally had like a quarter-sized hole in my skin where you could see metal. Terrifying, actually. Did not feel good either. Really hurt. So can you talk a little bit about why that happened and also the skin breakdown that it caused? And then I think it happened, let's see, that was my 39th surgery. So it's happened 4 times.
Yeah. Well, that's why we were trying to get weight on you. Um,
That would make
so,
sense.
you know, you put the rods in and you were so thin and your skin was relatively compromised because you'd had so many surgeries before. So it just, you know, we think about kind of, you know, if you kind of look at the skin on your arm and you kind of feel, you know, you've got a little chub in there, not a lot, but you know, but it's mobile. You can move it around, and so, but your skin was like really just a thin layer,
It
and
is. You can't move that. You can't move it.
yeah, it was stuck over the implants because it was scar. It didn't have that nice little fat layer to it. Um,
Will it ever?
Sorry.
Will it ever? Because it's
No,
scarred so much?
no. I mean, you could build some fat underneath that layer. So, but you know, and so what happened was it just eroded through the skin, and then the implants were contaminated, and then
They had to
once
go in and take them out.
yeah, and it's kind of a, you know, there's actually, you know, some scientific papers on this about, you know, is definitive fusion or final fusion really final, and it 25% of the time it's not.
Mm,
So, you know, you're not alone in that. Especially, you know, and it's generally, you know, kids who have been through a lot more and you know, so which you were like the perfect setup for it. So
there was I can't remember if it was you or somebody else, but there was a doctor that I had who said that if there's ever a small percentage of something, I'm gonna be in that. So we always need to like prep for that. So it's
yeah,
like 25%. If you had told me that before Halo or before my fusion, I'd probably be like, yeah, I'll be in that. So we might want to prep ahead of
yeah,
time. Because I'm just always in the 2% or the 5% or the
yeah,
20%. Like I'm always in that like
yeah.
small little percentage for health. Always.
Yeah, to
It's
be fair,
just
that paper hadn't been published yet at that time. So,
oh well. That it's okay. It's okay. We'll do
but
it.
to be honest, your data probably contributed to that scientific publication
You're
because
welcome.
we contributed to that group, and you know, we had a pretty large population of kids like you who we took
Yeah.
care of, and so I would not be surprised if your circumstance contributed to that knowledge.
Yeah,
So,
I wouldn't be surprised either. Again, I'm a scientific anomaly in a way.
yes.
I think your exact words before we started filming was me walking is a miracle.
Yeah, I
So
mean, it's you certainly, given everything you went through, defied the odds. So, if you want to look at
thank
it, you know, the positive side of the one, you know, of the low percentage, you won too, right? So,
what can I say?
yeah.
So for these last few minutes, I'm going to read off some of these questions that were submitted
Okay.
via
We'll do our,
Instagram.
we'll do our best.
Huh? Yeah, we'll
We'll
do our
do our
best. We'll
best.
do our best.
Okay.
Okay, so Hev Williams asks, what has it been like for you to witness me grow up from a child to an adult now?
Oh, it's amazing. So you probably don't know this, but I brag about you all the time. Um,
You do?
no, I totally do. You know, you know, I mean, you've always had a certain, you know, feistiness and fire, and which you and your mom shared, you know, which has been strength for you to get through everything you went through, and you know, and how successful you are, and you know, I talk about, you know, kind of when I talk to parents about your experience, I tell them, you know, and I actually tell them to Google you. And sometimes in clinic, we'll Google you in front of the families. And I say, yeah, this is Cass. she's awesome. And so this
Who's
is,
that?
back to the original story about the doctor who came in and said, your kid's never going to be anything, right?
Hmm.
That I'm telling them the opposite story and I can use you and watching you grow up and what you went through, to use that as an example of what's possible. And it also, on a more sort of day-to-day basis, things about, the headaches and all that you went through, every step along the way, you and your mother were very clear about what you were experiencing, and that really helps shape the way you approach people after you. Okay, well, yeah, I've seen that before and I've heard about that, and not all families are really, that forthcoming about what they're experiencing, and so it's been fun, and we've already talked about camp, so that's a whole other aspect of it. So no, I think
Yeah.
it's fantastic, to have seen you
Oh,
go from being a little kid to now a very successful adult. So
thanks. I try. Um, for you, Emily Grace asks, what surgery of mine stood out the most to you, and which one was the most difficult?
gosh, that's gonna tax my memory because this is probably what, 8 years ago now, right?
Yeah.
I
Yeah.
mean, yeah, I mean, I think it's probably, I wouldn't say it's a single surgery, it's the multitude of surgeries, and just I think the relationship that we were able to develop and kind of grow together, because your experience became my experience.
Yeah, that's
And
true.
so, yeah, so every experience was additive, and of course, I'm sure And again, I didn't remember you had a lumbar drain, which means you had a pretty tough go with a dural tear. But it's
I
that
think
clearly was
twice.
one of the more difficult surgeries. But yeah,
I think I had a lumbar tear during Halo, and then I had a lumbar tear after for
okay,
fusion. Yeah, because I remember having the lumbar drains removed twice. That's what I
okay,
remember. Yeah. Yeah,
yeah,
it
that's
was it
really
wasn't a fun
unusual,
time.
but yeah, it wouldn't be. I mean, not impossible. Again, I don't remember.
Hi.
I didn't go through your
Nice.
medical record before we spoke, so I don't.
How dare you? Honestly, you should have. I will say that do you remember when before everything was digital, like charts?
Mhm.
They used to bring mine in and it was like that thick. It's very thick. It was like three
Oh
and a
yeah,
half, 4 inches
no,
thick.
I mean,
And I that was before the age of like 5.
yeah,
So
yeah.
it was
Which is
I
about
don't know how
to
big it is now.
digital in Seattle. So,
Yeah, yeah,
um,
yeah. Now everything's digital. Thank God.
yeah.
My question, this is a question for me. Do you have a favorite inpatient memory with me?
Oh, it's definitely the raspberry mocha frappuccino with a half and half for sure. Yeah.
Great. My mom asked, do you remember me signing to you after my fusion? I was waking up from my fusion.
I do vaguely. Yes. Yes.
I do not. So I'm glad one of us does.
You had two in, so you couldn't speak. So you're
That's
breathing.
true. Yeah, I was pretty sedated. Yeah, were there any complications besides the dural tear? Was there anything unexpected
I mean, other
during
than
the fusion?
the infection and the eroded implants and the failed
All of that?
implants on the growing
Yeah.
rods and yeah, no, I
Yeah.
mean, your whole course was a complication.
Okay. Good. Good
And
to know.
that's why the technology now is, and the sort of the whole way we approach this is different in terms of how,
Mm.
we don't put the growing rod, we try not to put growing rods in before age 5. We try and find other ways.
Whoa.
So yeah,
Well, and now they're magnetic.
well, then there's magnetic growing rods as well. So you can just lengthen them without surgery, which was not an option. So yeah, there's a
Wild.
lot of different, we recognize as surgeons, as pediatric spine surgeons, the toll on kids to have these repeating and repeating surgeries with all the complications and everything else. that, the fact that, you're as well adjusted as you are, having going through all of that, is actually a little unique. And so, yeah, so, but there's an element, there's truly, and I'm not saying this in loosely, there's an element of PTSD that goes on with these multiple surgeries.
How'd you know I was diagnosed with that?
I did not. So
my therapist day one was like, "Oh, okay."
Yeah, no, it's very traumatic. So it's I can't remember how we got on this question, but it is real, and so we try to avoid putting kids through what you went through.
Thanks. I appreciate that. Please
Well, we've learned.
Keep them away.
We've learned.
So that was actually that was a question from my producer of this show, was how do you as the adult handle that emotionally? You know that you're going to have to, like, for my example, you know that you're saving my life and you're doing this medically for my own good, right? But like again and again, how do you emotionally navigate having to operate on the same kid over and over again?
Yeah, well, my wife tells me I'm very good at compartmentalizing. Kind of that you have to do, but
you have
to. Seeing your patients having the surgeries I do, like yours, are extremely high risk, and so I would be lying if I said I never had a kid who came out came out with who had a neuro deficit, if I didn't say that, right? And so that happens sometimes where kids can be paralyzed either permanently or temporarily. It's
I couldn't feel my feet for a couple years. I don't know why.
Well, probably because your spine, right? So your spine was being stretched, and I don't remember that being the case, which all the more reason to be concerned and why you were high risk, because that shows that your spinal cord is already under stress and is more prone to having problems.
It's like, please stop. I don't want to do this anymore.
Yeah, it's so, to answer your question though, it's you just, all you can do is sort of accept that that's the world you live in, and be very honest and upfront about it with families, and and if something happens that's not that's untoward, you just have to own it, and hopefully you've been smart enough to warn the families ahead of time that this could happen, so it's not a total surprise to them.
Yeah.
You just have to accept it, I guess, and then just do your best to make the best of the situation.
Emily Grace also asks, is it easier doing surgery on someone you've operated on before or harder? And why?
Well, it depends what you mean by the question. It's easier to operate on someone and you have a relationship with, and you can have a very a clear communication with. You kind of you understand each other when you're talking, because every surgery is a conversation. It's not a surgeon's decision. It's what we call shared decision making. So I present you with the options. I present you with the risks. I present you with the benefits. And
I remember having those conversations when I was really young, like going into my spinal fusion. You and Dr. Browd, I want to say, sat down with me because he was my neurosurgeon at the time, and you guys were like, "Look, we're gonna wake you up during surgery. All right, like we have to make sure that you can still function, and that like you're not paralyzed. But like as a 14-year-old, you guys were like, look, you might wake up from this surgery paralyzed, and if that's the case, we'll figure it out." Then I was like, okay, cool, great.
So yeah, but it makes it easier to have those conversations.
Yeah.
So now operating as we talked about with the dural tear, if you go in on a multiply operated, spine or leg or whatever, it's scar tissue. It's surgically much more technically challenging. that's the flip side of that equation.
I'm a one-woman show. That means that I write all of these scripts, film all of these videos all by myself. But I also have a team of amazing editors. And as you can imagine, it costs some money to be a 23-year-old entrepreneur. So that's why I started a Ko-Fi. And so many of you were asking how you can support me being able to do what I love and make videos for all of you. That's why I started a Ko-Fi. If you head on over to my Ko-Fi and drop a donation, you automatically become a representation booster. And I shout out one representation booster in my weekly YouTube video. So head on over to my Ko-Fi, drop a donation, and who knows, maybe next week I'll shout you out. Back to the video. Yeah. Maggie Moo 104 asks, how do you effectively communicate complex concepts to young patients?
I mean, you speak in plain English, show lots of pictures. We now, we've developed videos, animated videos that you can watch.
That's smart. That was not a thing when
No,
I
it
was
wasn't
little.
a thing. I'm very fortunate here in Colorado that I have a terrific animator who has made these videos for me on spine surgery and other aspects of, right now we're doing kind of some rare disease stuff. So
if you need them voiced over it, let me know.
Yeah, that might work. We can maybe hit you up there.
Yeah.
So we'll talk about that. But yeah, so but there's different ways, and you have to acknowledge that really kids under age 8 or 9 really just don't understand. They're never going to understand. And
not the gravity of it, no.
No, certainly not the gravity, and certainly and not the technical aspects of it. It's just not going to happen. And you see parents trying to explain it to them. It's like, fine, if that makes you feel better, but they're not really going to, it's just not cognitively, psychologically, possible. But as they get into their teens, then, the patients need to be part of the conversation. And I will stop, I try to explain it to the parents first. I will look at the patient, child, teenager, whatever, and just kind of make sure they're kind of listening and following along. And then I will turn to them and I'll say, okay, do you understand what we're talking about? And then, can I explain it to you differently or whatever? And so, for the more complex the surgery, then the more time it takes, and you just have to have that time. You just have to set that time aside.
I think you and Dr. Brown sat down with me for like an hour.
Yeah, probably an hour
before my fusion, and you were like, listen. And it was just me, because my mom had already had this conversation. But you guys were like, okay, this is what we're doing step by step. This is how we're going to, deal with this situation. This is when you're going to be woken up. This is when you're going to be put back to sleep. This is what you can expect coming out of it. All of the above. And you guys were like, questions? And I was like, yeah, actually a lot. I do have a lot of them. Small things.
You always did, yeah.
But I mean, even with those conversations, I grew up around it, right? I grew up around conversations surrounding my body and complex medical concepts. So there were a lot of things. I mean, I don't think I was a normal child developmentally because of that. And I think that I was a lot more cognizant of the conversations surrounding my body, and I understood a lot more because it's all I'd ever known.
Yeah.
So even when you were having conversations with my mom, I was still taking all of that in, and I did feel like I was part of the conversation because you would pause and be like, okay, that makes sense. Everybody good? Everybody still on board? Great, moving on, and continue that conversation. So I always felt like I was a part of my own medical care that way. The last question that I have for you is from Inclusion Starts Now. And they ask, were you always confident about the surgical choices you were making for me?
To a certain degree, yes. The goal is always what's the best possible route with my abilities to give you the best functional outcome with the least risk of harm. And so, and as I said earlier, this is a shared decision-making process. This is not my decision. This is our decision. And so all I can do is explain to you what I think is the best thing to do. And you know, most of the time it's like, okay, well, I think if you think that's the best thing to do, then let's do that, right? We trust you.
Yeah.
Sometimes though, and I think even this happened with you and your mother, it's like, well, what do you think about doing this instead? Which is totally fine, right? And sometimes I'd say, well, no, I've thought about that. I don't think that's the best option because X, Y, and Z, right? But sometimes it was like, I hadn't thought about that. No, let me think about that. Or if I think about that now, sometimes you think on the fly and say, actually, that makes sense, and we can do things a little bit differently than planned. And so all you can do is make the best decision possible. Once you make that decision, you kind of live with it. Again, but it's not so much about the decision; it's more about the intent. And the intent is you're hopefully doing surgery for the right reasons, and you've thought it through as best you can. And sometimes you get it right. 99% of the time we get it right. Sometimes we get it wrong. That's medicine. That's surgery.
That's why my mom always says that's why it's called practicing medicine.
Yes.
Okay, those were all my questions. Do you have anything that you want to say? Finally.
No. First of all, just thank you for having me on. This has been a lot of fun. And I think I do want to acknowledge the fact that there's all kinds of people out there in the world, and so I think having that variety and that difference and those different perspectives is so important, and I'm so happy that you bring that to light with your video and your podcast. So
thank you.
I'm just really excited to be part of it. So
thank you. I try my best, and keep Googling me in
yes.
outpatient. I guess.
I will continue.
Thank you. Thank you so much, Dr. White, for being here. I really appreciate it. Again, I did not expect you to say yes. So I'm
anything for you, Cass. Anything.
I feel very fortunate that I had as good of the best medical care that I could have asked for, and also that I'm not paralyzed. So thanks for that. I really appreciate you and all you've done for me, and that you kept me alive. So thanks.
I'm glad I did too.
And thank you for listening and watching to this episode of The View from 4 feet and 3 inches. Please make sure to hit that subscribe button because it definitely does help me out. Comment down below if you have any more questions for Dr. White. Who knows? Maybe I'll have him back on. But please hit that please give me a 5-star rating because that really does help the show out. Make sure to go follow me on all my other platforms because I do post on Instagram, Facebook Reels, TikTok, and YouTube Shorts every single day. I have a YouTube vlog that comes out every Wednesday and a podcast episode here on The View from 4 feet and 3 inches out everywhere you listen to podcasts every single Sunday. Thanks so much for watching, and we will see you next week. Bye!